All right, hello everyone, and thank you so much for joining us for this webinar. We are really excited to have Dr. Jonathon Egan, who is the Dean for Los Angeles College of Chiropractic, with us today. My name is Luke Phillips. I'm Assistant Vice President for the School of Professional Studies, and I'll be helping to field questions and do the Q&A later. A few quick things before I pass it over to Dr. Egan that we want to let you know about. The presentation is going to be a lot about the chiropractic industry, why chiropractic and why now. But then later on toward the end, we will have a little bit of discussion about our chiropractic program and the curriculum and other things like that. And we'll be able to answer questions and talk about the admissions process later on. But if for any reason you have to go and you can't stick around for the whole thing, you can always find more information at scuhs.edu/DC for the DC chiropractic program. Also, if you have to leave and you want to watch the rest of it later, this will be posted up at youtube.com/SCUHS. All right. Also, if you have any questions, if you look down toward the bottom of your screen or somewhere on your screen, there should be a box to add in a chat. So you can add in your questions and that kind of thing. And we will try to get to as many questions as we can toward the end of the webinar. But if we aren't able to, we'll make sure to email you back later on with the answer to your questions. You can also email admissions@scuhs.edu, and we'll be happy to answer your questions there as well. So with that said, I'm going to turn it over to Dr. Jonathon Egan to get things started.
Hi, everyone. I really appreciate you joining with us today. I'm excited for the chance today to talk to you about the chiropractic profession. As Luke said, why chiropractic and why now? I am really an optimist about healthcare and about chiropractic specifically. I feel like really the brightest days for chiropractic still lie ahead. So just as a quick introduction, this is what we're going to talk about today. Luke already mentioned it, so I'll come to this slide. I joined SCU, Los Angeles College of Chiropractic, about 1.5 years ago, and I moved here from upstate New York. That was a big move. But I was excited to come here because Los Angeles College of Chiropractic and SCU we're really trying something special, and that is integration in healthcare, really trying to work together with other health professions. And so my family was kind enough to make the move, and I didn't have to move by myself. So this is just some pictures of my family as they've enjoyed some of the things down here in the Los Angeles and Southern California area. So Harry Potter World down there in the bottom right corner. That's honestly how I got them to move. The kids, I said, hey, if we move, we'll go to Harry Potter World. But anyway, as far as my background goes, I completed chiropractic college back in 2006. I completed a master's of public health degree. I worked at the VA for a while, and the chiropractic within the VA has really grown. It was a great opportunity to work in an interprofessional setting, again, which is part of what intrigued me about coming here to Southern California. I also pursued a PhD in public health, and really see that there is a great opportunity for chiropractic and public health, and for chiropractic and other professions to work better together for the betterment of patients everywhere. And so that's a little bit of what we'll talk about today, because the question is, what is happening in the world of health and in the world of healthcare? And what I'm going to talk to you about at first actually isn't very pretty, because there are problems, but it'll set up why I believe chiropractic and what SCU is doing here are part of the solution, part of what is needed in the future. So probably for this audience, you're well aware that the healthcare system is in crisis. But exactly how is it in crisis? And there's a lot of fronts to this crisis. I mentioned 3 here. There are more, and I'm just going to even just highlight a couple of issues. But we could have long conversations about these. The first one that I'll mention is there's a crisis of cost. So in the United States, you'll see on this graph from 1980 to 2013, what percentage of gross domestic product various industrialized nations have spent on healthcare. You see in the US, it's well above where all other industrialized nations lie. I pulled a quote down from this website. Basically said that the United States is devoting at least 50% more of its economy to healthcare than these other nations. And that this isn't driven by necessarily the most prudent use of resources. So it's spending on high tech and spending on greater utilization of that tech instead of on routine services, on prevention, and on health generation, on health creation. So you can see that's a huge problem. And the question is it even sustainable? And then as we look at this next slide, this is healthcare spending as a percentage of gross domestic product. Again, you can see the United States down at the bottom, just completely out of line from other industrialized nations, other Western nations, and nations around the globe. So it's not just a crisis of cost. This is a slide I hope just really catches your attention. But look at the outcomes we get. So we just showed that we're spending at least 50% more of our gross domestic product, of our economy, on healthcare than other nations. Well, on this list, you'll see some very industrialized nations. And if you look at the bottom at the blue circles that I've highlighted there, you'll see that our life expectancy at birth in the United States is years shorter than other nations who are spending much less on healthcare. If you look there at infant mortality, you'll see that our infant mortality is triple Japan's. You'll see that it's double other nations. Again, for what we're spending on healthcare, the outcome in human cost is extraordinary. The next column over, the percentage of population 65 plus with 2 or more chronic conditions, down at the bottom, it lists the conditions that they're considering, such as high blood pressure, diabetes, cancer. In the United States, it's 68% of adults over 65. And you'll see other nations there are just nowhere close. The UK is actually just half of that. And then the next column over, the obesity rate. The United States is, again, far and away the most obese of these Western nations. The website here, this report that this comes from, said that even well-off, non-smoking, non-obese Americans are in worse health than their counterparts abroad. So our outcomes for what we're spending really need to give us pause, and we need to think about how can we do better. This is a slide that probably some of you have heard reported in the news. It turns out that, at least by one estimate, this was 2016 British Medical Journal, that medical errors in the United States might be the 3rd leading cause of death. It's just kind of a staggering statistic. But also next to it, cancer and heart disease, many of those are lifestyle diseases and are also preventable. And COPD is often preventable. And as you look at this list, most of these actually have a high preventable element. And so again, for what we're spending, are we doing enough to actually generate and create health? This one to me is a heartbreaker. It turns out that the single greatest predictor of life expectancy in the United States is your zip code at birth. There's tremendous health disparity. And so this is an example map from the Robert Wood Johnson Foundation showing some zip codes within about a 60-mile stretch of one road. And depending on what exit you're born at, your life expectancy varies by more than 9 years. It's just an extraordinary thing for us to consider. How can we create health better for all Americans everywhere, and even throughout the world? And here's another, just look at the outcome. This is life expectancy at birth, and the United States is down there at the bottom in between Chile and the Czech Republic. Now, the crisis that we're experiencing also extends to healthcare access. It's not surprising. If, for example, if you see the zip code variation in life expectancy, we wouldn't be surprised to see that poorer populations had worse access to healthcare than better-to-do populations. This slide shows, though, that on 21 measures of access over there on the left, that those who are in poor income had worse access on all of those issues. But this even shows that the racial and ethnic disparities in healthcare access in the United States are also a tremendous problem. So again, for what we spend, which is 50% more than anybody else, we have problems on access, we have problems on outcome. So that's kind of the backdrop, but what else is going on? There's more. Probably all of you watching have heard about the opioid crisis happening in the United States. I actually can't spend enough time on this particular slide, but we'll take just a minute here. If you'll look down at the bottom, I don't know if you can see my cursor, I believe you can. You'll see that deaths are marked off at 10,000 increments, and you can see how much the death rate has increased from 1980, where this graph starts, even if we come over to 2005, but you can see how quickly it is rising. What I want to show you here is this line right here across is the peak gun deaths in the United States. The worst year of the highest number of gun deaths was 1993, and it was almost 40,000 deaths. It's still, to my knowledge, above 30,000 gun deaths per year. It's still a large number, but this is the peak. Now, if you come up to the worst number of deaths we ever had at the peak of the HIV crisis, you'll see that we're around here at 45,000 deaths. You'll see here at 1972, the peak car crash deaths in the United States. And there were all sorts of movements to create safer highways and seatbelt laws and to prevent drunk driving. All sorts of things have happened. But there is the peak car crash deaths that we ever had. And now if we go to 2016 and drug overdose deaths, I believe the final number was 66,000 deaths in 1 year. That number is still rapidly climbing. You can see that the trajectory of this graph. It's a crisis on just of enormous proportions, and it's worthy of our very, very best efforts. And I'll mention again later in this presentation, but we need to reflect on the importance of a drug-free and highly trained healthcare profession that is able to diagnose and manage patients in pain, and that's what chiropractic is, among other things. So just keep in the back of your mind, this is part of the healthcare landscape now, is a opioid crisis of enormous, enormous human cost. This is a story that maybe some of you are familiar with. This is about the diseases of despair. This is a fascinating concept and kind of just a sad concept. So it turns out in the United States that the death rate for middle-aged white Americans is climbing. You can see here on this graph that if you look at the nation of France, Germany, Britain, Canada, Australia, Sweden, it's in steep decline. It is also for, you can see Hispanic Americans on there, and it turns out, in fact, in the United States right now, the death rate is declining for middle-aged blacks and Hispanics. And so that even though middle-aged blacks still have a higher mortality rate than whites, the gap is closing. This is just a tragedy, because what is behind this rise, what the research shows, is suicide, drug abuse, opioids, and diseases that stem from drug and alcohol abuse. It's been called diseases of despair. And we are just in stark contrast to other countries. So you see down there at the bottom, the increasing cause of deaths per 100,000, in this case, white Americans, and look at what's happening here with alcohol and drug poisoning, suicides, and chronic diseases that stem from drug abuse. It's, to me, just, again, a human tragedy. So we've got this crisis that underlies the landscape. And what I want to go to here now briefly in the next section is this idea that Americans might actually have forgotten how to be healthy. I'm going to just point to, for a few minutes, a little bit about nutrition, a little bit about physical activity, sleep, substance abuse, a couple of just general areas where these are things that if people would make what should be simple changes, lives could change. And sometimes these need to be changes at the individual level, at the community level, the state and national level. But here's a first look at nutritional intake. So if I had a group of people in the room with me, I'd say, hey, you know, how many servings of vegetables should people have in a day? And a lot of people will quote the, you know, Strive for 5 ad campaign. Well, it turns out that they said strive for 5 because they didn't want to break anybody's hearts, because the number you're actually supposed to get is so much higher than that. It's actually supposed to be 7 to 11 servings of vegetables per day. And the average person, when they did their studies, as you can see on here, was getting like 2 per day. And so they thought, well, if we can get people to strive for 5, that would be at least something. It turned out that didn't work. So now they just say vegetables, eat more, essentially. But you can see that nationally, the average person's diet is completely lacking in nutrition, you know, the nutrients that would come from healthy vegetable consumption. Now, this next slide I have on here, this is from a nationally representative survey about physical activity. There are probably some of you on the webinar in the 18 to 24 age group. If you are in that group that is managing to be about 60% of you meeting the recommended physical activity guidelines per week. You can see that for just about everybody else, including adults as they age, that falls off. So when we look at the statistics in the United States about heart disease and diabetes and dementia, which there's some correlation to physical activity, this is where the root cause is that people are not meeting even the minimum physical activity guidelines to stay healthy through the lifespan. So this one is a story that just about everybody's familiar with. In the United States, obesity has been on a long increase. So on this chart, you can see the percentage of adults who are obese. This is not counting overweight. This is just obese. And you can see that in essentially all states, it's at least 20%. In some states, it's over 35%. Obesity is related to many negative health outcomes, but shortened lifespan, cancer, heart disease, stroke, we can go on, even affecting sleep and so forth. But have we as Americans essentially forgotten how to be healthy? And who is it that can intervene with this group and help them to make the lifestyle changes necessary to rediscover and to create health? This is I'm going to talk about sleep for a second. Not everybody thinks about sleep as an important part of health, but it turns out it's one of 5 behaviors the Centers for Disease Control recommends for preventing chronic disease. That goes along with moderate to no alcohol consumption, physical activity, maintaining a healthy weight, not smoking, and then getting enough sleep, getting at least 7 hours of sleep for adults. So this chart on here just shows that essentially 1 in 3 adults, close to 1 in 2 adults for some groups, are getting less than 7 hours of sleep a night. And that's important in the long term because it turns out that not getting enough sleep is associated with a host of chronic diseases. So you'll see here in this chart comparing people who got less than 7 hours of sleep with more than 7 hours of sleep. And look at the incidence of things such as depression, 22 versus 15%. Look at the incidence of arthritis. I do have that on here, 30% versus 20%. People who aren't getting enough sleep are more likely to have strokes, more likely to have heart attacks, more likely to have asthma, more likely to have kidney disease, more likely to have diabetes. And so sleep has been described by some researchers as an additional vital sign that we as healthcare providers should be paying better attention to with our patients. So we say, hey, have people forgotten how to be healthy? We look at what are they eating? Are they sleeping? And we saw in here, what's their physical activity like? Are they obese? Are they overweight? These are things that we can address and change lives. Man, there's another bad news slide. We're going to move to good news here in a second. We are starting to hear researchers say that this may be the first generation in quite some time. There might have been a dip around the Vietnam War, but this will be the first generation in many generations that might die younger than its parents. So what this graph shows is the observed mortality rate, the observed number of years of life left at age 65. And this red line is if you were to have projected the same rate that you saw between the year 1940 and the year 2000, if that projection had continued, this is it. And you'll see that they've continued to revise down the projection because people keep dying younger. So here's the 1981 projection, the 1984 projection drops, the 1995 projection drops, the 2003 projection drops. And we are, at this point, high likelihood that the Americans born now will die younger than their parents, and it's from things like diabetes, heart disease, obesity, cancer, and the like. This one is a look at back pain and neck pain globally. So a lot of times when people think about chiropractic, they think back pain, neck pain, headache, joint pain, and so forth. So this just shows, well, how extensive is the problem? It turns out that globally, this is probably hard for you to see online. It's a small picture, but this very top row here, low back pain in 1990, in 2006, and 2016 was the single leading cause around the world of years lived with disability. Neck pain is number 6. So this is just an enormous problem of enormous consequence. It's affecting people everywhere. And if this is the why chiropractic, why now? If low back pain and neck pain are among the largest societal causes of years lived with disability, and if these are problems that we can address, if chiropractic is a drug-free profession in an era when opioids and drug abuse are killing an American every 15 minutes, and if chiropractic advocates an evidence-based lifestyle and holistic medicine looking at the whole person, approaching their diet, their exercise, with an awareness of physical, mental, social, emotional, spiritual health, looking at the whole person, body, mind, and spirit, this is why chiropractic, and this is why now. So we took the time to look through the landscape, the extent of the healthcare crisis we're experiencing, so that we can understand the problem. But the solution, at least in part, is a natural, therapeutically conservative, highly trained profession that's ready to work with the whole patient, the whole person. So I'd like to share with you on a couple of slides just some basic information. I obviously don't know who's watching this webinar, but hopefully some of you at least are considering joining us here at our college to become chiropractors. I want to share with you just a few statistics. So first of all, there's a triple aim, or excuse me, there was a triple aim. There's now a quadruple aim in healthcare, and that is to provide care that is, safe, effective, cost-effective, and that doesn't burn out the provider. So that was the new quadruple aim. The triple aim didn't used to consider the provider. We want to have a provider who loves their work, who feels valued, and who is able throughout their lifetime to continue to do the work that they're doing and serve patients and serve humanity. So we can have a whole other future webinar on safety and effectiveness. I just put in a couple of slides here to just show some recent literature. The first is that the American College of Physicians recently published a guideline last year that recommends spinal manipulation as a first-line treatment for low back pain. And I believe this is acute, chronic, and subacute low back pain. That was prior to discussing medication with patients. And so when it comes to safety and effectiveness, this group has reviewed the literature and has recommended to its family physicians and its providers that spinal manipulation, which is the central modality used by chiropractic, be a first-line recommendation for patients who need treatment for back pain. The other one I just put up, this also was just published last year. This was an article from the Journal of the American Medical Association. And their summary of the paper, I took a screenshot of, which is right here. It was just asking, is manipulation an effective treatment for patients who've had back pain less than 6 weeks? And their determination was, after reviewing a large number of randomized clinical trials, that yes, there was statistically significant benefit in pain and in function of modest magnitude at up to 6 weeks with very minor transient adverse events. So you essentially have an effective therapy that has a very low risk profile. And so they're backing it up. Then I just have 2 slides here on cost effectiveness. And again, we can have a whole other future webinar on these. This is the cost of care for common back pain initiated with a chiropractor versus a medical doctor as their first contact when they have back pain. And the study, basically, if you come down here to the results, it says the paid cost for episodes of care if it started with a chiropractor was 40% less than if the episode started with a medical doctor. So then it said, let's say you risk adjust to the severity and nature of the condition, it was still 20% cheaper to see a chiropractor first. And so that's just a huge cost savings. Again, if we say back pain is the number1 cause of years-lived disability and neck pain number 6, so you take this incredibly prominent condition and you say, hey, if you see a chiropractor first, it's 20 to 40% cheaper. The opportunity is there to literally save billions of dollars. Now this next slide this was published in 2016. This one's looking at older adults, but it's the association between use of chiropractic care and the cost of care with people with chronic low back pain and multiple comorbid conditions. And they found, I'm going to look over here in the results section first. It said that people who saw chiropractors, they might have gone to the chiropractor more than they would have gone to their medical doctor, but there was enormous cost savings because there was a huge reduction in the likelihood of back surgery the year after if they saw a chiropractor. And so the costs actually were significantly reduced. And so again, down here at the bottom, the study found that older, multiply comorbid patients who had only chiropractic manipulative therapy during their low back pain had lower overall costs, shorter episodes, and lower costs of care per episode day than in any other treatment group. So again, we'll have a whole other webinar at some point, but we've shown that chiropractic is effective and we've shown that it's cost effective. So the question is, do patients like it? And actually they love it. So this Gallup-Palmer poll done in 2016 was a nationally representative poll. And the question was, for people who've actually seen a chiropractor in the last year, was it effective? 95% said yes. And if you ask those same patients, would you go back if you had neck pain or back pain? And 97% of them said yes. So again, it's extraordinary patient satisfaction. And those of you who are familiar with chiropractors who have been there before, you know that it can often be a really strong relationship between the chiropractor and their patient because of this kind of therapeutic bond that comes from this kind of effectiveness. And then the last one is, can we avoid burning out the provider? And so a lot of times we want to do work that we feel committed to, that we almost feel a personal mission towards. And that's what this number, the top stat on there. For people who want to make the world a better place, that's the number 7 job, is to be a chiropractor per pay scale. I know that for me as a chiropractor and working with my patients, it was incredibly, incredibly rewarding work. You feel like you can intervene in their life. You can teach them how to eat right. You can teach them how to exercise, even to just start walking. You're changing their life. And so that's it. Number 7 job for people who want that. Number 1 best job that exists for job security. They said there's less than 1 in 1,000 chiropractors are unemployed. And then just some other jobs, other ratings from other sources showing that there's high job satisfaction. It's one of the best jobs. So that anyway, the chiropractor themselves enjoys the work and feels a connection to the patients and feels the appreciation of the patients. All right, so that's the background. So why would you want to come to SCU? Luke, why wouldn't you want to come to SCU?
I know, that's a good question.
Okay.
I'm looking forward to hearing about it.
So let me talk about the program. So overall, our mission is to educate a student to be competent, caring, successful, integrative practitioner. All 4 of those words matter a great deal to us. I mentioned at the start of this presentation, it was the integrative piece that drew me here. I'll talk about it a little bit later, but one of the things that is most unique here at SCU is that our chiropractic students are in class together with our acupuncture students and our physician assistant students. And any class, it makes sense to be together. If you think about it, a heart exam is a heart exam. A lung exam is a lung exam. If you're learning how to test a shoulder, it's the same if you're a chiropractor or a physician's assistant, et cetera. And so as people learn general anatomy together and biochemistry together, they learn from each other, with each other, about each other, and they're building bridges, they're building networking opportunities, they're building understanding. We believe they're building the teams of the future. And so for me, that's what brought me here. That's what I hope will bring you here, is that chance to be an integrative healthcare practitioner. I don't believe chiropractic should be over in the corner somewhere anymore. I believe it should be front and center in the healthcare system. And so we need to treat it that way and be part of this team and part of this mix. Okay, so I'm going to talk a second about professional identity here at LACC. And we're going to time? Yeah. All right, so there's 8 terms down there at the bottom. These terms were published in an article by LACC about a year ago. And we basically went on record to say, if you come to LACC, this is what chiropractic means to us. These 8 terms define the LACC chiropractor. And for those of you who are listening, if you're trying to decide whether or not you would want to attend here, I'm going to briefly describe these 8 terms to you. If they resonate with you, then this is the right school for you, because that's who we are. It's what we're about. If you hear some of these and think, I don't know about that, then we may not be the right school for you. And there may be another health profession or another health college, and we can help you connect with them. But if what I describe is you, this is the right place for you. So when I first saw these 8 words, I didn't know what they all meant. I had to look some of them up, but then once I looked them up, I knew, yeah, that is me. So the first one on there is vitalism. The idea there is that the body really does heal itself. If you are a healer working in a health profession, your job is to let the patient stay empowered. It's their body that's going to get them better, and you're just trying to introduce the right nudge in the right direction to help their body be able to restore its health. The next one on there is holism. That's the idea that we're going to look at the whole person, their body, their mind, their spirit, but also their work environment, their community, et cetera. Where does their ill health come from, and how can we create health creation by looking at the whole person? The next one on there is naturalism, and that just means that we have a preference for the most natural remedy that we can apply to get the health outcome that we need. And that ties to the next one, which is therapeutic conservatism, which means we want to do the least remedy possible to get the greatest possible outcome. The classic thing is that you wouldn't start with surgery when a medication might work, but you wouldn't do a medication when not using a medication would work. If you can introduce chiropractic care, if you can introduce exercise and lifestyle medicine. So it's the least intervention you can do to get the outcome. The next one there loops around is critical rationalism. That is LACC's claim that the way that we gain knowledge is through the scientific method. And so we embrace evidence and the scientific process, and that is how we make knowledge claims about what does and what does not work. The next one on there is phenomenology. That is not like the Muppets, phenomena. Okay, never mind. Phenomenology is the idea that every patient is having an independent, unique experience. So one person with back pain is not the same experience as someone else with back pain. So for example, you can imagine a patient coming into your office who says, you know, my dad had this kind of pain once. He ended up having to have surgery and never had to work again, never could work again. And so I'm never going to get better. And that belief about the experience they're having is very different from maybe someone else who walks in and goes, oh, my back is killing me, but I can't wait to get back in the game. Can you fix me? They might have the exact same diagnosis, but they're having a different experience. And we want to recognize that and work with that. The next one on there is humanism, and that's the idea of treating every person with dignity, recognizing their autonomy, recognizing their humanness and their humaneness, and treating them with dignity. And the last one is interprofessionalism, that we believe that the patient's at the middle, not the chiropractor, the patient's at the middle, and we're going to surround them with what they need, and it's going to be healthcare teams that are the future. We want to be part of teams, and we want to contribute to teams, and we want to lead teams where it's appropriate. So that is our professional identity here. And again, if those 8 characteristics resonate with you, welcome here. We'd love to have you here. So they resonate with me, and that's why I'm here. The other thing about SCU is that we are really integrative pioneers. We are the first chiropractic college, for example, that also has a physician's assistant program. But as I mentioned, the unique thing about us is that we share class time together. So as much as 40% of your class time will be shared with healthcare students from other professions. You will have faculty from multiple professions. When you enter the clinic system, you'll be treatment rooms right next to each other with different kinds of providers seeing patients. There's a chance to do grand rounds with other providers. We really want you to learn from, with, and about each other. We feel like it's the best way to learn, and you will understand your role very, very well and who you are when you can compare and contrast to others, but also can feel part of the team and develop a team identity. So that is us. And again, if that resonates with you, we welcome you here. We really are integrative pioneers. I'd love you to come and be one with us. These are just some areas where we are also trying to lead. I mentioned interprofessional education, not just where we're trying to lead, but these are really where we do have leadership positions. So I mentioned the United States Olympic Committee affiliations. About 75% of all the current chiropractors that work for the U.S. Olympic Committee are alumni of Southern California University, and the medical director is one of our faculty members. And that's cool when you think about it. The medical director for the U.S. Olympic Committee is a chiropractor. The next one on there is that we're leading out in sports medicine and tactical sports medicine. Tactical sports medicine is a growing field. This is helping like sheriff's departments and police departments and fire departments to, as the recruits are training to prevent injury and to promote retention, and then also those who are working in those fields to quickly get back to work when they're injured. So these are people who are kind of high performance employees. This is also true for helping active duty military to prevent injury through the course of training, and then to quickly return to the field essentially. So when injured, and so we're leaders in both of those areas. And then also primary spine care. This is an area that we are leading and want to maintain a leadership position. We have a spine care residency. And primary spine care, the idea there is to train a practitioner who's able to manage essentially any patient condition that's related to the spine. So low back pain, mid back pain, neck pain, headache, and to be able to manage their whole care episodes, even if it requires referral, even if it requires surgery, that you're able to connect the person with the right resources and to manage the overall patient care. So just a brief word here about our outcomes. If you were to come to Southern California University, there are 9 main areas that we would want you to leave with a tremendous skill set. That's the first one would be the ability to assess and diagnose a patient, and the second would be the ability to manage that patient. Those are kind of obvious, but the others would be, you know, that you learn how to promote health and prevent disease, that you become skilled at communication and record keeping. That's just central to healthcare. There's a lot of paperwork, but it's important in our interprofessional communication. That you develop a strong sense of professional ethics and jurisprudence, so you're able to act within the law. The information and technology literacy, that you become skilled at delivery of chiropractic manipulation, and that you become highly capable of working in interprofessional collaboration. And the last one is just that you would have a foundational knowledge in the basic sciences, so that whether you want to teach, whether you want to do research, whether you want to practice, that you would have the science knowledge and the ability to acquire evidence and to synthesize evidence to be able to do whatever it is that you want to do and do it successfully. So let's talk a little bit about our curriculum now. We have 2 major options and then a whole bunch of variations by choice. The two main options are that we have a 10 trimester long program, and that's true whether you enter in fall or in spring. And we have a 12 trimester program, whether you enter in fall or whether you enter in spring. And it's a cohort-based program, so when you enroll in it, you automatically get a set of courses and you just take them and you progress through the program and you finish when you get to the end of it. Some students, based on your application, are required to take the 12 trimester program, but anyone else has the option of 10 or 12, excuse me. As far as the variations go, we actually have something called selectives that begin as early as the 3rd trimester, and they extend throughout the program. This is where courses are offered in a wide variety of areas to let you tailor a part of your program to your own personal interest. And so again, there's this main track that is cohort-based, but then the option to take some additional classes at your interest. This slide here gives you a general overview of the overall program. And you'll notice that we start you right away in basic sciences. The importance for that is there's certain things you just have to understand to be able to be a doctor. So we're going to start you in anatomy, we're going to start you in biochemistry and so forth, neurophysiology. And that will continue through the first 2 years heavily. Diagnosis, we actually used to not start those courses until term 3, but about a year ago, we started introducing physical exam skills right away. And so now from term 1 all the way through, you have diagnosis related courses. And then the purple bar here is chiropractic courses. You will start right away in learning how to feel, to palpate the structures of the body, and then moving through soft tissue techniques and other techniques, and learning how to adjust and perform chiropractic manipulation, and it rolls right on through. This line here is clerkship, refers to the clinical experience. So Southern California University has, I think, a uniquely robust clinical experience. Starting as early as term 3, you can use this red selected bar. You can use your selective courses to choose to go and observe in doctors' offices. We've had affiliations with literally hundreds of chiropractors in the community. And so if there's a chiropractor that you have a strong connection with, or if there's one that we already have a relationship with, you can arrange that and go and observe in their office as early as term 3. And you can also observe with some of our doctors that have that set up. And then as early as term 5, you can start to actually do elements of patient care under supervision. And again, that's optional there. But for everyone, one way or another, starting in term 7, we have the Introduction to Clinic course where you start to do patient care. And then in term 8, 9, and 10, you have many hours a week. You're basically in clinic all the time for this last year. And that experience is varied. Some of it is directly in our supervision and in our clinics. Some of it are in clinics that we operate that are off-site. And then some of it is with other providers and satellite clinics. And then some are with these hundreds of affiliated doctors in the community. Very robust, wide variety of experiences you can have throughout your time here in the clinic system. The last one down here is just we have some exams that you have to pass at certain milestones through the program. Essentially, as you finish the first year basic sciences, before you enter clinic, and then before you graduate is how you can think of them. And they're a combination of written and practical exams to help you assess your skills and abilities as you go through. And if there's any areas that show up with weakness, it helps us know how to help you so that by the time you graduate, you're feeling completely ready and strong and prepared. So another word about the selected program. It does turn out, it's about 15% of all the available hours. They are offered a couple of different ways. There are actual tracks, so you can take a series of courses and end up getting essentially a certificate in that area. So if sports medicine or chiropractic technique or functional medicine are areas of interest to you, you can do 6 courses and get a certificate there when you graduate. We offer courses in a lot of areas. I have them listed down here at the bottom of the slide. But also, interestingly, because we're an interprofessional program, it's possible for you to take even some courses in yoga, Ayurveda, some introduction to acupuncture meridians, Tai Chi, so things that are in some of our other programs, so you can be exposed to those and know what those are. One of the strengths of SCU, one of the things we're most proud of is the strength of our sports medicine program. There are several different ways to participate in sports medicine if that is your interest. It ranges from taking courses while you're in our program to a very strong postgraduate sports medicine residency, and that's the group from which most of those U.S. Olympic Committee doctors have been hired. So just a brief word on these. Number 1 and 2 are the same program, but one's honors. And in that program, it's a 10-course series of sports medicine courses, 2 additional technique courses, a advanced imaging course, and a soft tissue course. And that's what they have in common. If you decide to do the honors version of it, if you maintain a high GPA, if you present at the ACBSP, which is the sports group in chiropractic, and if you pass a skills-based test when you graduate, then you finish with this honor sports medicine program. It's a truly elite designation, and it's one of the things that SCU is known for. And as I mentioned, number 2 is the same thing, just without those few extras. Number 3 is if you decide to just take the 6-course track, like this sports medicine or functional medicine or technique, then you can get the certificate. It's more limited than the program, but still a 6-course series. The other is this a la carte. So every one of these courses, as long as they have openings in them, anyone can take. And so you might just want to learn about taping, but not want to do the whole sports medicine program. You can do that. And so this a la carte selective is available for you. And the last one, as I mentioned, is postgraduate. We have a very competitive paid sports medicine residency, and that leads to the diplomate in sports medicine. It's just a strong program. A little bit about our clinical experience overall. So I mentioned in 7th term, everybody starts introduction to clinic. And then in 8th term, each chiropractic student, and the terms I'm using refer to the 10-term program. They're slightly delayed in the 12-term program. But in 8th term, everyone is assigned to a base clinic, and those are listed here. And then you start to work in 8th and 9th and 10th term in combinations of sites. So I mentioned let's step back. In term 3, you can start to work with our affiliated doctors in observation. In term 5, you can start doing limited clinical work. In term 7, everyone has this introduction to clinical care in our own health center on campus. And then in term 8, you start to do combinations of our campus clinic, these base sites, satellite clinics, and private clinics. And those private clinics the satellite clinics I've listed on the page here, these are just some of the affiliations that we have. We basically give you all sorts of opportunities to seek care in any number of settings. So this can be care of the underserved, care of the underinsured, care for veterans. Some of the clinics serve patients who have HIV. There's an HIV-based clinic. So there's a wide variety of opportunities. And then down there at the bottom, we also have service clubs that participate in a wide variety of activities. So the AIDS Life Cycle is one of the most kind of cool and dramatic events where our students go and participate with this ride that goes from San Francisco to LA. It's a multi-day event, and our students treat the cyclists as they participate in that really long ride. VA stand-down events where we go and help veterans at those events, and many others. The service clubs are out many weekends through the trimester participating and serving these groups. So the overall message I'd like to share with you is what I have written at the bottom. Aspire to excellence. We strive to do that here. If you came as a student here, it's what we would ask of you. We'd want to support you to do it because it's all for future patients. You never know what you learn or what you master as you go through here. What piece of information that might seem inconsequential is going to be the thing that really matters to someone someday. And so the program is really challenging. I can't sugarcoat that. I share that whenever I do campus preview day and otherwise. It's a hard program, but it's rewarding to go through it successfully. And it has to be hard. The human body is this extraordinarily complex and beautiful machine, and we want to be prepared to help our patients. So it's challenging, but you can do it. We are actually, over the next few years, raising our admission standards. So for the group entering in 2019 and in 2020 and in 2021, the bar is going to be getting higher for each of those years. Stay in touch with the admissions department. They can help you know what those are. But the reason that we're raising it is because it's a challenging program. We want everyone who comes here to be ready. And believe me, when we admit you, it's because we believe you can be successful. We know you can do it. We'll provide you all the support we can to get you through. Our goal is to see each admitted student across the stage for us to be able to call them doctor and peer and friend in this profession of ours and to be ready to serve humanity. So it really is aspire to excellence. And remember that whenever it's tough, just, all right, it's for the future patient, it's for the future patient, and that you can do it. The last slide I want to share with you here is a quote from our president in 1968. Goes back a bit, and I love this. LACC is as tall and as great as you. Ask yourself again, if chiropractic would grow taller, it's we who must grow. So we want you to believe in yourself, believe that you can be an outstanding chiropractor. If the mission of our school aligns with you, come and be part of it, but then come and be the very best that you can be, because chiropractic is only as good as we are. We are the chiropractors, and it's we who must grow, and I really, truly do hope you'll come and join us here. And thank you. Well, we actually want to take a second and just share with you what the admissions process is, and then do some questions.
All right, very good. Thank you, Dr. Egan.
You're welcome.
That was wonderful, really good stuff. A lot of doom and gloom, you know, but then we get into the exciting things, which is what we want, you know. I mean, it's a really exciting thing to be a part of what's happening here at SCU.
Absolutely.
And so I know a few, or some of you may have joined who have specific questions around the admissions process. So I want to talk about that really quickly, and then this will just take a minute, and then we're going to get back to some really exciting things and ask some questions and do a little discussion type of thing. So just really quickly, if you're wondering kind of, well, what does it look like? How do I apply and what do I do? If you have any interest at all in starting in any future cohort, we strongly encourage you to go ahead and fill out the application. Most people, it takes them 10 to 15 minutes. It's a really simple process. It's at scuhs.edu/apply, and you just click on the DC application. If you go on and use the code waiver in capital letters, that will waive your $50 application fee. So we encourage you to go ahead and do that. And then a lot of times students don't realize, you know, it can take a bit of time from the time you apply until you're in the seat. So they'll think, oh, we have a fall start coming up in September. I'll wait until August and get things started. We would really encourage you, go ahead and get started, because even as fast as you are and as fast as the admissions office will be able to get things through our system, sometimes you're trying to get transcripts from other schools and things like that. It can really take a while for a number of reasons, especially if you've been to many schools. And so after applying, the next step is to start getting those transcripts into us so that we can evaluate. We don't ask you to do anything else. You don't have to send us your license or social security number or anything yet. You just go ahead and apply and then start getting your transcripts in. We'll evaluate those, determine admissibility, or let you know any next steps you need to take. If admissible, we would then go on to the next step. So the next step then would be an interview with one of the faculty, and then the acceptance, and then a $250 non-refundable holding deposit. And then once you do that, you're considered part of the cohort. You begin to get information about your syllabus, your orientation date, and those kinds of things, so that you're all set and ready to get started. So that's really the application process. And I think just one last thing was just some reminders. If you want more information, we have the website here. We're going to leave this up for the rest of the recording here while we talk. We have about 10 minutes left, and there was so much good. I had a list of questions, and Dr. Egan, I was checking them off the box as he went through. But a few things that maybe we can kind of talk about before we finish. So one of the things, Dr. Egan, you talked about was the interprofessional piece and the integrative health kind of idea. And if we were talking to students out there and they're looking at a chiropractic program, there are a lot of single purpose institutions, and they're kind of an integrative mindset. And so you did a great job, I think, of explaining that, you know, ours is, I talked a lot about the interprofessional education, that 40% of your curriculum, you'll be side by side with PA students, acupuncture students, and that kind of thing. And that goes from the classroom all the way through into the clinic. But then there's this thing that's integrative health. And so this idea that not only do we not educate in silos, but our students are prepared not to practice in silos either. And this idea that when different professionals of different healthcare bring the best of what they have, it results in great outcomes for patients at lower costs and that kind of thing. And so this team-based collaborative, could you tell us just more about the kind of what that means, and why that's of value to a future student?
Absolutely, that's a great question. So I mentioned that I had worked at the VA for several years, and that's where I first saw this model working. So chiropractic was pretty new in the VA when I started there. I think I was in one of the very first sites that had a chiropractor. And one of the things that was fantastic was that you could read other providers' notes. And so when I had a patient that was coming to me, I could learn all about them, see what medications they're on, see what they've been treated for, see what their background history was. And then I knew what had been done and maybe what hadn't been done, and I could tailor my work to support the other things that we're getting and to provide what they weren't already getting. And I felt like we got much better outcomes for that. And it was because there was this team that had surrounded the patient. And so I think through chiropractic's history, for many reasons, some of them were political and otherwise, chiropractic was kind of over here when healthcare was over here, you know, and there were a lot of patients who loved their chiropractic. Chiropractic did just fine, but it's been over here. And I think more and more people are realizing that it can be a part of this team and equal with other professions and kind of contributing to the well-being of patients. What we offer is a solution to many of those problems that I talked about today. No one provider can do everything that needs to be done though. And so it's working together for the patient, with the patient in the middle.
Yeah, very good. And we often say that we're preparing today's student for the healthcare system of tomorrow, with the belief that really this is where it's going.
It is.
That's what you would say?
Yep. And I mentioned the opioid crisis. If there's one thing, I mean, it's a tragedy, but if there's one thing that's going to push non-drug interventions into the forefront, into the middle, it's that. Now, there's going to be mindfulness-based therapies and acupuncture, and chiropractic. It's not going to just be chiropractic, but non-drug needs to find its way to help solve this problem.
That's great. I think another question that like a prospective student might ask is, and they're looking at schools, that kind of thing, is accreditation. So can you tell us about the accreditations we have at SCU? Yeah,
well, for the chiropractic program, we're accredited by a programmatic accreditor, which is the CCE, that's the Council on Chiropractic Education. And then we also are accredited by a regional accreditor, which is WASC. So we basically are fully accredited, and so students can get student loans, and that we're able to give a valid diploma, then go license and practice.
Yeah, very good. And so if anyone's out there listening, you hear WASC and hear CCE. So CCE is the council that would then accredit all chiropractic colleges.
Yes.
And so if you don't have that, you don't have a chiropractic college, really. And then WASC, they also accredit a lot of really good, like Stanford.
Just undergraduate and graduate schools in a wide region of the country. Yep.
All right, very good. One of the things about the curriculum also is a lot of times medical related fields of chiropractic and others, they'll learn a lot of medical knowledge, scientific kind of things, and in this case, technique and clinical experience. Well, there actually are so many more things that you kind of learn that aren't just scientific. So, for example, you talked about a lot of selectives that you can learn, different techniques you can learn. Well, there's also things like business skills that you learn. Can you tell us about some of that the students will have?
Absolutely. So yeah, we actually built into the curriculum a series of business courses. So we want to make sure, for example, you know how to code and build so you can get paid, you know, when you graduate. So yeah, there's practice development courses. There's courses on jurisprudence, so to learn the laws around practice. Some states actually have licensure exams you have to pass about the law in the state. So we teach about that. We're developing some marketing classes, which I appreciate. Can't wait to get from you. Yeah, we want to make sure that everybody graduates feeling ready, not just to work with the patient, but to succeed in the business of healthcare.
There are classes in things like nutrition. We also are working on some things in postgraduate and continuing education. So if anyone's listening, you're looking to become a chiropractor, one thing that you'll have to do is continuing education and that kind of thing. And so we're developing a lot of things like health coaching and nutrition and yoga foundations, and even clinical genomics and precision medicine and many others. And we find that similar to like what I said before, you learn a lot of medical, but actually working one-on-one with individuals. So things like health coaching really help round you out as a practitioner. And I think that we also have alumni from who are on every continent across the country. So that postgraduate opportunity that you have of being in Southern California, can you tell us like what's the benefit of being the only chiro school in this area?
Well, so just generally, California has the most licensees, the most chiropractors of any state in the United States. I think there's like 13,000 chiropractors in this state. So you already have a great network there, but we are the only chiropractic college in Southern California. The other colleges are up in the Bay Area. And yeah, there's a network of many, many graduates who are all alumni from here. And so not only will our alumni department try to help provide any resources we can, but we're kind of a resource for each other. And that's this network that's out here. Absolutely.
And it's good that as you get out there into the integrated space, you are then alongside alumni of acupuncture and
Yeah.
PA and other things too.
Right. It's a network that's bigger than just a chiropractic network, and that's one of the great strengths of what we're trying to do.
It helps with job opportunities and future growth and other kinds of things, and networking in the future. You'll find, I think, students find as one preparing a marketing course for chiropractic students, that networking is just so crucial as you move along in the career. So another thing is there's a great experience kind of after graduating, but while you're a student, there's a great student experience that you have on campus. You're not just learning all day. Right. Is there anything you could say about that experience and interaction with faculty? And even I know that you actually get out and talk to students and that kind of thing quite a bit. Yeah,
well, so it's a great campus community. One thing that I would say that has just been fun for me when I've worked here for the last year and a half is how many social events are thrown for the students. There is food all the time, but food from many, many, many cultures and parts of the world, because our programs represent so many cultures and parts of the world. So that's fantastic. So there's a vibrant student life. There's a lot of clubs that are active, service clubs and technique clubs, and you name it. And then yes, the faculty are super open and welcoming to basically an open door. Come in, talk with them. There will be support for you. I'm the same. My door's open. Come on in, and again, walking around and talking to students is one of my favorite things. So.
Yeah, that's great. Yeah, we do have mentioned the clubs. We have over 25 clubs and associations on campus, and all the clubs have some kind of service thing that they do as well. So there's a trip down to Bolivia serving an orphanage. There's a Being Alive Coalition that's predominantly HIV positive group that they serve at least twice per week, per month. So a lot of just tons of opportunities. There's the Associated Student Body. So if someone's interested in leadership or that kind of thing, they can be involved in that as well, on the governing body for the students as well. Also, there's something about being in Southern California. So that to me was one of the I want to be here. It's about 74 degrees, 73 degrees every day, there. And then also within a pretty quick, our location, a lot of people may not know, we're in North Orange County, right on the edge border of Los Angeles County. So access to Los Angeles and all that has to offer to the west. And then we're in the hub of Orange County. Down below and actually to the west a little bit, you got the beach right there within probably, 20-minute, 30-minute drive, or you could be in the mountains in the same day. So you could be snowboarding and then you could be surfing in the same day.
Guys, I moved here from upstate New York. The last 2 winters have been the best winters of my life. I just want to say that. But yeah, what he's saying is true. I mean, we've had, I showed the picture in the beginning. When we went down to Harry Potter World, you go to the beach. We do day hikes, so we go up to the mountains. We've been to the opera in downtown LA. There's museums. There's all my favorite bands. Even if nobody knows who they are, you can see them here because there's so many people. So yeah, as far as being in Southern California, a huge selling point.
Yeah, for sure. It's great. And then our the campus, the way it's set up is that every class is sort of you have to walk outside to get to the next class. So you're outside like most of the time when you're between classes. We have one pavilion, but it's like all glass. So you see like you're getting that natural light and that kind of thing. So that's one of the things I like the most about
outdoor lifestyle.
Yeah. So, well, that's pretty much all the time. Any last thoughts you have before we go, or anything you want to say to the prospective student?
Thanks for your time. I appreciate your time and your interest. Again, if what we said has resonated with you, we hope you'll consider applying and coming here. It's a great profession. There's something very powerful in being able to be closely working with patients, your hands on them to help heal them, but also having the training to help them through some very complicated and difficult times often. It's an awesome opportunity. Hope you come.
Great. And then as you see on the screen there, again, if you have just any questions, you can always go on our website to read more. We have most of the information there, but we encourage you to call and talk with us in the Office of Admissions so that we can give you more depth information and answer any questions you have. You see there we have the application page if you're interested in applying, and then this recording will be up at youtube.com.